Ladies, before you head into your next blood test, pause for just a moment. Many women over 60 unknowingly make small mistakes that can completely change their results. These errors can delay a correct diagnosis, cause unnecessary stress, and even lead to treatments you never really needed. It happens more often than you think. Perfectly capable, smart women show up for their appointment, yet a simple oversight makes the numbers on the page look worse than they really are. In this video, I'll walk you through 10 of the most common mistakes seniors make before a blood draw, so you can protect yourself and ensure your results truly reflect your health. And yes, mistake number 9 is something even some nurses overlook. If this topic matters to you, remember to like, subscribe, and gently tap the notification bell. 1. Forgetting to fast or fasting too long. Among all the errors women over 60 make before a blood test, this one shows up the most often. Fasting sounds simple, but it is where things go wrong time and time again. Certain tests, including those that measure blood glucose, triglycerides, or cholesterol, can only give a true picture of your health if you avoid food and drink for a specific period beforehand. That window is usually 8 to 12 hours, no more and no less. Here's what often happens. Some women, busy with appointments and daily routines, forget the instructions. They have a small breakfast, maybe a slice of bread or a morning coffee with cream, and then head to the clinic. That seemingly harmless snack pushes blood sugar or triglycerides higher, and suddenly the report suggests diabetes or abnormal cholesterol when nothing serious is happening. Doctors may even consider medication that isn't really needed. On the other side of the spectrum, some women believe that longer fasting means more accurate results. They wait 14 to 16 hours or more before the draw. In reality, this stresses the body, raising cortisol, lowering blood pressure, and making dizziness or fainting more likely. Prolonged fasting can also temporarily disrupt kidney function markers or electrolyte balance, leading to numbers that look worse than they are. The solution is straightforward. Always confirm with your doctor which tests require fasting and which do not. If fasting is needed, stick closely to 8 to 12 hours. Water is perfectly fine, but coffee, tea, or anything with milk and sugar will distort the outcome. This balance ensures your results reflect your true health, not a mistake in preparation. 2. Taking medications that interfere with results. This mistake is subtle, and most women are not to blame for it. Many doctors forget to mention it, and many patients forget to ask. Yet some of the most common medications and everyday supplements can quietly distort blood test results in ways that cause unnecessary worry. Take biotin. For example, it is a popular ingredient in many hair, skin, and nail formulas. It looks harmless, but it can interfere with thyroid hormone tests. The result may suggest low thyroid activity or give the impression that your medication dose is incorrect. Even when your thyroid is functioning normally, anti-inflammatory drugs such as ibuprofen may influence kidney function markers. Steroids can raise both blood sugar and white blood cell counts. Diuretics, sometimes called water tablets, may upset potassium, sodium, and other electrolytes. Even vitamin D, if taken right before testing, can make calcium levels appear falsely high. The problem is that many women do not think of vitamins or herbal remedies as medication, but your body does not recognize that distinction. Everything you swallow changes your internal chemistry, and the lab results will reflect it. So what is the safest approach? Be completely transparent. Share a full list of everything you take with both your doctor and the technician drawing your blood. That means prescription medications, over-the-counter pain relievers, herbal teas, oils, powders, vitamins, and even essential oils you ingest. In some cases, you may need to stop a supplement for 24 to 72 hours before your test. But never guess. Always ask first. That one question can prevent a confusing result and save you from an unnecessary change in treatment. 3. Not drinking enough water. Picture this scenario. It is early morning. You arrive at the clinic for your blood test, and you have gone without food or drink for 10 hours. The band is placed around your arm, but the nurse struggles to find a vein. She switches arms, presses along your hand, warms the skin, yet nothing seems to work. The reason is simple: you are dehydrated. Older adults are particularly vulnerable to mild dehydration. As the years pass, the body's ability to signal thirst becomes weaker. At the same time, skin and blood vessels lose elasticity, making veins harder to access. Even if you do not feel thirsty, your body may already be running low on fluids. This does more than make the process uncomfortable. Dehydration changes the concentration of your blood. When fluid levels are too low, test values like hemoglobin, hematocrit, and electrolytes can appear falsely high. Even kidney function markers such as creatinine or BUN may look worse than they really are. All because your system is short on water. The good news is that the solution is straightforward. Unless your doctor has specifically told you to avoid fluids, a rare instruction: you should drink 1 to 2 glasses of plain water about an hour before your appointment. Not an excessive amount. Just enough to rehydrate and make veins easier to locate. And remember, water only. Juices, coffee, or tea may interfere with the accuracy of your results. A small step like drinking water before your test can mean the difference between misleading numbers and a clear picture of your true health. 4. Exercising strenuously the day before. Staying active is one of the best things you can do for your health. And gentle daily movement is encouraged at any age. But when it comes to preparing for a blood test, the timing of your exercise matters. A hard workout the day before can do more harm than good for your lab results. Here is why. Strenuous activity, especially weight training or intense aerobic exercise, creates tiny tears in your muscle fibers. This is part of how muscles grow stronger, but it also triggers temporary changes in your blood. Markers such as creatine kinase (CK), liver enzymes like ALT, and lactate dehydrogenase (LDH) may rise significantly. If your doctor is checking for liver problems, heart issues, or muscle disorders, those elevated values may look like red flags, when in reality they are just signs of recovery from yesterday's workout. This can be particularly confusing for older adults who already live with joint pain, muscle aches, or have been told they may have inflammation or fibromyalgia. The false positives can create unnecessary stress and even lead to medications or follow-up tests that are not needed. The safer choice is to keep activity light in the 24 to 48 hours before your blood draw. Walking, stretching, or gentle yoga are excellent options. What you should avoid are long hikes, heavy lifting, or any high-intensity exercise. This small adjustment helps ensure your results reflect your actual health, not the after effects of an intense gym session. 5. Showing up anxious or flustered. There is one factor that rarely appears on any list of test instructions, yet it can strongly influence your blood work, your emotional state. Walking into the clinic rushed, stressed, or breathless after traffic puts your body into a mild fight-or-flight response. In that moment, hormones like adrenaline and cortisol rise, and the effects spill over into your lab results. Blood sugar may spike temporarily, blood pressure can climb, white blood cell counts may shift, and even thyroid markers or heart rate can appear out of balance. To see how powerful this can be, consider one case. A woman arrived late, still tense from her commute, and nervous about the needle itself. Her results showed unusually high cortisol and glucose, Just 1 week later, in a calmer setting, she repeated the same tests. This time, everything was perfectly normal. Nothing had changed in her health, only her stress level. If you are investing the time to get tested, make sure it counts. Arrive early and give yourself 10 to 15 minutes to sit quietly before the draw. Breathe slowly, let your heart rate settle, and resist the urge to scroll through alarming news on your phone. Think of it as setting a baseline. The same way you would zero out a scale before weighing something, by calming your body first, you ensure the numbers you see reflect your true condition, not the stress of the moment. 6. Not asking which tests require special prep. It is easy to assume that all blood tests follow the same simple routine: show up, roll up your sleeve, and wait for results. But the truth is, many tests require very specific preparation, and ignoring these details can lead to numbers that do not reflect your real health. Without the right timing or adjustments, even a carefully performed blood draw may become meaningless. Consider a few examples. Fasting is essential for glucose and lipid panels, but not for thyroid function. Thyroid hormones, however, should ideally be measured in the early morning. Iron studies are also best scheduled for the morning, but not immediately after taking an iron supplement. Hormone panels can be influenced by whether you are on hormone replacement therapy, so that information must be made clear. Cortisol and ACTH tests are highly time-sensitive, usually performed between 7 and 9 a.m. due to natural fluctuations. Even calcium or parathyroid hormone readings can be distorted if you have just taken vitamin D or calcium tablets. The mistake many women make is assuming the laboratory will automatically account for these details if the physician's instructions are incomplete, or if you don't ask. You might end up fasting unnecessarily, or worse, skipping fasting when it was required. In both cases, the reliability of the test is compromised. The solution is remarkably simple. Before your appointment, call your doctor's office or the laboratory and ask directly whether any special instructions apply to your tests. This small step only takes a minute, but it can save you from confusion, repeat visits, and inaccurate conclusions. Do not leave your results to chance. You deserve clarity, and that starts with knowing how to prepare the right way. 7. Drinking alcohol the night before. For many people, enjoying a glass of wine or a small drink with dinner feels like an ordinary routine. There is nothing unusual about that habit. But if you have a blood test scheduled the next morning, alcohol is one of the most overlooked mistakes that can significantly distort your results. Even modest amounts of alcohol can create measurable changes in your body chemistry within hours. Here's what happens. Alcohol can elevate triglycerides, raise liver enzymes such as ALT and AST, and contribute to dehydration. For individuals who take medications for diabetes, alcohol may also lower blood sugar in unpredictable ways. On top of that, it can interfere with the way your body processes other medications, leading to misleading lab values that your doctor may interpret incorrectly. Imagine you are going in for a liver function test. 2 glasses of wine the night before might cause your enzyme levels to appear higher than normal, prompting your doctor to order repeat labs, ultrasounds, or further investigations. If you are being evaluated for metabolic syndrome, alcohol can also make your blood sugar and lipid profile appear worse than they truly are, leading to unnecessary worry. The solution is simple and entirely within your control. Avoid alcohol for at least 24 hours before your blood draw. If possible, give yourself 48 hours. It is a small sacrifice for peace of mind and accuracy. Clean, reliable results should reflect your real health, not the lingering effects of last night's drink. 8. Wearing tight sleeves or hard-to-remove clothing. Clothing may seem irrelevant when it comes to a blood test, but in reality, what you wear can have a bigger impact than you think. In clinics, It is surprisingly common to see patients arrive in fitted long-sleeve blouses, multiple layers, or sweaters with narrow cuffs. The result, they struggle to roll up their sleeves, sometimes needing to undress awkwardly in the small phlebotomy chair. Others manage to force sleeves up, only to cut off circulation in the process. These delays not only slow everything down, but also add unnecessary stress. Why does it matter? Phlebotomists need clear, easy access to the inner elbow, the antecubital fossa, where the most reliable veins are typically located. If clothing blocks that area, the procedure may become more difficult, increasing the chance of discomfort or repeated attempts with the needle. Restrictive sleeves, especially in colder environments, can also limit which arm can be used, reducing options for a smooth and efficient draw. The good news is that this mistake is completely avoidable. Choose a loose, short-sleeved shirt, or wear a cardigan that opens easily in the front. Both allow quick access to your arms without added stress. Simply put, comfortable clothing leads to a faster, easier, and far less stressful experience at your blood test. 9. Not mentioning menopause or hormone therapy. This is one detail that often slips through the cracks. Even in professional healthcare settings, a woman's hormonal status can significantly shape how her blood test results appear, and this influence grows more pronounced with age. Yet many women, and sometimes even clinicians, overlook how essential it is to share this information. If you have gone through menopause or are currently taking hormone replacement therapy, HRT, your doctor and the lab need to be aware. Estrogen therapy, for instance, alters cholesterol readings. Women on HRT frequently show higher levels of HDL, the so-called good cholesterol, and lower LDL. If no one knows you're using hormones, these numbers might be interpreted as unusually positive. Or your medication might be credited with benefits that actually stem from estrogen. The same applies to reproductive hormones. Levels of FSH and LH, which are used to assess menopause or fertility status, carry very different meanings depending on whether hormone therapy is involved. Even thyroid function panels can be influenced, since estrogen changes how thyroid-binding proteins behave. There was a case where a woman was referred to a specialist for suspicious estrogen results, only to realize later she still had on a transdermal estrogen patch that the lab staff never accounted for. The lesson is clear: always provide full disclosure. Mention if you are postmenopausal, if you are currently on HRT, if you have recently stopped treatment, or if you are using patches, creams, or oral forms of estrogen or progesterone. Even when it feels unimportant, context matters. Blood work should be interpreted with the whole picture in mind. Your results are only meaningful when your hormonal background is taken into account. 10. Leaving right after the draw without checking. The moment the blood is drawn, many people assume the process is finished. The vials are filled, the bandage is applied, and the instinct is to rush out the door. But this is exactly where preventable mistakes often occur. Walking away too quickly without verifying a few simple details can create unnecessary stress later. First, confirm that every test requested by your doctor has actually been collected. It is not uncommon for a tube to be missed, or for a timing-dependent test to be overlooked. If that happens, you may be called back for another appointment. Second, ask whether the correct amount of blood was taken. Certain tests require precise volumes, and if too little is drawn, the lab might reject the sample and force a repeat. Third, check that your samples are properly labeled. While rare, labeling errors can lead to serious mix-ups that complicate diagnoses and delay treatment. It is also wise to clarify how you will receive your results. Will your doctor call you? Should you log into an online portal? Or is a follow-up visit expected? Understanding the plan prevents confusion later. Finally, your safety matters. For seniors in particular, standing up abruptly after fasting can cause dizziness or even fainting. Take a few minutes to sit, drink some water, and let staff know if you feel lightheaded. There have been cases where patients hurried out, only to stumble outside and require medical attention, not because of the blood test itself, but because they left too quickly. The takeaway is simple: slow down, ask questions, and confirm the essentials. A few extra minutes ensure both accuracy and safety. And there you have it, 10 simple but powerful mistakes to avoid before your next blood test. By paying attention to these small details, you can help ensure your results are accurate, your doctor has the right information, and you save yourself from unnecessary worry or repeat visits. Remember, your health is worth those few extra minutes of preparation. I'd love to hear from you. Have you ever experienced confusing or unexpected blood test results? Share your story in the comments below. Your experience could help someone else. And if you found this video helpful, please give it a like. Subscribe to the channel and gently tap the notification bell so you won't miss future health tips designed just for you.